Bella, okay? So first we're just going to do hip flexion. I try to bend her knee. She doesn't like bending your knee, so I just do it a little bit just to take the hamstring some slack. I'm really stabilizing the bottom part of the hinge. And I'm trying to just slowly ease. She does guard a little bit. So I try to ease into some hip flexion, and the idea is to try to get, we're getting, I think the other day we got about 50. Most frames will let you get at least about 70. We hold for like about 20 seconds. Most frames will let you get at least 70. So that's kind of be our goal as time goes on, to kind of work on her and then come back up. And usually what happens to be the limiting factor is this barrel ends up butting up against here, which we end up stopping at 70. Some, I don't know about her frame, some end up hitting some up here, but since we haven't gotten that far yet on her, I'm not sure which will limit. But if she's getting 70, that is like an A+. That's all, like, that's great.
Okay.
So that'll be the hope. And we measure, just so while I have her right here, we use the X-Fix just for consistency, for measuring, for hip flexion, instead of using her pelvis or whatever. It's just, so when we like measure, we're using this as the axis, or lining up with the X-Fix, just so that we get consistent measurements, so that when you guys send measurements to Dr. Standard, it's kind of how we've been taking measurements, just bisecting the pelvic frame and then bisecting the femoral frame.
Okay.
So as you can see right there, she's about 20. So when I give you the measurements that she's about 50, it's just that she's 50 on that hinge.
Okay.
So to keep measuring that way, just for consistency. And then the same thing with straight leg raise, just we do the same thing, but with a knee straight.
And
just so
then
that she gets a little bit. It's about 20 seconds. And we usually do, I mean, for her, I spend, depending on how sore she is that day, I can spend the majority of the time on hip flexion, just because that's the one she tends to have more pain and guarding with.
Mm-hmm.
So, I mean, some days I'll spend 20 minutes on hip, just between the two. Kind of depends on how she's feeling that day. But since that's the one that's more limited right now and more sore, I spend more time on it. So I say I do 4 for 20 seconds, but I spend time warming up. I'll probably do 4 for 20 seconds at her end range, where we count and she knows I'm really pushing. Mm-hmm. But I'll spend a lot of time warming her up to that.
Okay.
So I'd say I spend most days 20 minutes on her hip flexion right now.
Okay.
So.
Is that good?
Yep.